Welcome to Innovative Pilates. So this video is for people with knee pain, perhaps some arthritis or post-trauma, an injury that you may have sustained. Just low-level, nice exercises just to start to regain a little bit of range of movement and some strength back into the knee. I'm just going to focus on the left leg. If you have problems with both knees, either repeat the video or pause and just repeat the exercises on the other side. So we're just going to have a look at range of movement first of all. Actually, before we start, I have got a yoga belt here. You can use a dressing gown belt if you've got one. I've got a rolled up towel, this is just a hand towel, and a Pilates ball. If you haven't got a Pilates ball, you can always use a bath towel rolled up as well, so a much sort of chunkier one than that. I have a pile of books, a chair, and I've got a resistance band tied around something sturdy. In this case, it's the leg of the table. Okay, so going back to look at range of movement, please feel free to lean back against a wall if you've got one handy. I'm just going to prop myself up on my arms. So looking at my left leg, just seeing how close my heel slides to my bottom and then how close the back of my knee gets to the floor. If you have the advantage of having one good leg, you can always compare the range of movement to your good leg. So see how close you can get your heel towards your bottom before you start to feel any pain or perhaps tightness if there's swelling in the knee. And just sort of take a note, maybe even measure with a tape measure, and then just take a note on how close you can get, and you can use sort of finger depths here, how close the back of that knee can get to the floor, and you can always compare one side to the other. So turning this into an exercise, either leaning back onto your hands like I am, propping yourself up against a wall, or you can even lie flat on the floor, just sliding that heel towards your bottom and back again. If that's quite difficult to do on something which isn't supposed to be slippy like a mat, you can always get a duster or something and do it on a shiny floor. Okay, so if you find you can only bend and get your heel to your bottom to a certain point, and you think you can get more range of movement out of it, depending on the amount of flexion you've got will depend on how thick your towel is. So pop a towel to the back of the knee and then see if you can just hug that heel in towards your bottom, relaxing the leg as much as possible. The idea being hugging this heel in towards your bottom using the towel will just gap and create space at the front of that knee joint. And it should be pain-free. So you might just hold it for perhaps 5 to 10 seconds and then release. Now, if you haven't got as much flexion as I have, you will clearly use a chunkier towel. If you've got better flexion, then you can reduce the size of the towel. And perhaps repeat that 5 to 10 times with a 5 to 10 second hold. Once you've worked on your flexion, you might find then trying to work into extension, straightening the leg, becomes a bit painful. That won't last. All you need to do is just slowly ease back into that extension, and that will loosen off again. Okay, and same if you've worked on straightening the knee, it can then be uncomfortable to bend it. So looking into your extension, if you can't quite get the back of that knee into the mat, if you place a rolled towel underneath the heel, a passive stretch is to just let the leg muscles relax and use your hands to help encourage that knee into the mat. And again, with as minimal pain as you can get away with. It might be useful to loop your dressing gown belt around your foot, pull the toes up towards you and then press down just above the kneecap, so no pressure onto the kneecap itself. And again, you can hold for 5 to 10 seconds, longer if you wish, and then release. Press down and then release. To get a little bit more of an active stretch, you need to use the muscles. So think about pressing the back of the knee, firing up your thigh muscles as you go. One muscle that wastes away quite quickly is the muscle just to the inside of the knee, your vastus medialis oblique. So if you turn the leg out very slightly, so my kneecap's rolled out to the side and press down, you're looking to fire up that muscle. Take the towel away and then just press the back of the knee if you into this range of movement now. So to progress, pressing the back of the knee into the mat and just trying to lift the heel. If you're not sure whether that heel should be lifting, if you've got a good leg to compare to, then just check and see what you can do with the other side. So usually most of us can lift the heel a couple of centimetres off the mat, and you can press and hold. Press and hold and roll the foot in and out, just again to fire up the different parts of the quad muscle. And you can repeat that perhaps 10 times or so, so feel free to pause and just carry on with that exercise a few more times. To give yourself a bigger range of movement into your knee extension, you can use your ball, or again, as I said, your larger towel, and just press the back of the knee into the ball and lift and lower the heel from there, firing up these quadricep muscles. Perhaps again rotate the kneecap out slightly, just to try and favour the inside of the knee joint. Lifting and lowering the leg like this creates a pumping action for any swelling. So if the knee is a little bit puffy, by getting these quadriceps to flex and relax can help with the swelling as well. Swelling can be very uncomfortable, so the more you can reduce the swelling, even by a little bit of massage, perhaps a little bit of icing, by movements like these, your full range of movement exercises will all help with that swelling. Press the back of the knee down and hold. If there's any swelling down into the ankle and foot, perhaps try some nice ankle circles in one direction and then rotating back in the other direction. And it's really nice just to get that ankle and foot moving anyway. And again, thinking about pumping, action, getting those muscles, helping with fluid retention. Okay. Just removing that ball. Coming into some stronger leg work now, pressing the back of the knee into the mat, lifting the heel, and then thinking about small lifts and lowers of that leg. This is going to work you very strongly into your hip flexors as well. So lean yourself back a bit more if you wish, if your shoulders allow that. Perhaps prop yourself up on some cushions, or just lie down flat with a little pillow behind your head. And you can allow that leg to lift all the way up, really working strongly into that quadricep and into that hip joint. I'm pressing down into my right leg a little bit to help stabilise me. So I'm trying to keep the pelvis nice and still and my low back nice and still. Okay? And then once you've worked those thigh muscles, just loosen the leg off again and come back into these knee flexion and extension. Okay, so while we're on our back, we want to think away from the knee joint and think about strengthening up through the hips as well. So if you place the ball between your knees, bring your heels towards your bottom as comfortably as you can. By squeezing your ball, you're going to fire up your inner thighs. Your inner thighs come down and attach around the inside of your knee joints. So squeezing the ball and sending your hips up. Now if you press your feet into the floor, make sure you weight bear through your big toe, your little toe, and the two corners of your heels. And you're just allowing those hips to lift as far as you feel comfortable to, enough to hopefully feel a little contraction in the back of the pelvis. and we can come up and hold. We can do some small little pulses, just squeezing and releasing those bottom muscles. Squeezing the ball will help take some of the tension out of the hamstrings. If you find you can't get your heels close enough, and as soon as you lift your hips up, your hamstrings cramp and fire up, do one of two things. Either put your feet against a wall, or use your band and pull the band towards you, and that should help ease any overactivity in your hamstrings, until such a time as that your range of movement improves and you can get your heels closer to your bottom without needing this little extra support. Okay, another nice range of movement exercise, which will also target these tummy muscles, is just to do a little bit of a cycling action with the leg. So using gravity to assist in that knee flexion. So if you try and relax that knee as that heel comes towards your bottom, and then fire up your thighs to reach the foot back up to the ceiling. Doing it with the other leg down, nice and relaxing, just working the leg itself. So if you want to do a little bit with the tummy muscles, place your hands down, brace your tummy muscles and bring your other leg into tabletop. And then just do some small cycling movements with both legs. If this hurts your back at all, or you find your back is arching, put your other foot down straight away. Okay, so we can make the movements bigger depending on your comfort and your range of movement. And you can reverse, challenges the concentration and the brain cells to try and cycle backwards. If that's too much strain on your tummy muscles, but you quite like the idea of that exercise, if you just lift your hips by placing your towel underneath your hips, try that, and that should make it a little bit easier on your tummy muscles, so you can just focus on your legs if that's what you want to do. And you can time yourself here. You can do 30 seconds to a minute, maybe even a couple of minutes if this feels quite nice to do. When you come back down, bring both feet down one at a time and then lift your hips. Let me just check that I've done everything I want to before we come onto the side. Just one exercise I wanted to just talk about on your side. Keeping the legs straight, both legs straight, or you can keep your underneath leg bent. Use your pillow to support if you wish to, your towel. Reach your leg away, so you're lifting your underneath hip. And just to fire up these bottom muscles, lift the leg up and down. Nothing else is moving, so as I'm lifting my leg up and down, I'm keeping my hips nice and still. You can do this with a bent knee, as though you're just cocking your leg, lifting the leg up and down, and you want to think about firing the back of the pelvis here, these bottom muscles, so either with the leg bent or the leg straight. So if you do perhaps 10 to 15, 2 or 3 sets. Okay, right, so we're going to come into standing now. So in standing, first exercise I'm going to talk about is your standing version of this. So when you press the back of the knee into the mat, this is a much more functional way to do it when you're a little bit more pain-free. So I've tied my band around something sturdy, in this case the table leg. You can always use a banister if your banisters are sturdy. Put the band, make sure you spread it wide, don't have it all scrunched up because that will dig in. Put the band around the back of the knee or just above the knee if the back of the knee is sensitive. And then notice as you step your foot away, the band is pulling you into flexion. So you're going to stand up nice and straight. Just draw your tummy muscles in, and then you're going to try and straighten that leg against the band. So I've got weight equally distributed between my both feet, and just firing up my thigh muscles again, pressing my knee back into that band. And again, just going to move it to the side a little bit, just digging in on the side here. Just adjust it, don't suffer. If it's hurting, but move it. And now I'm going to have a go at coming onto one leg and showing off and seeing if I can just hold my balance while I do it. So ways you can progress this exercise: stepping your foot back and making the band tighter. That can progress your exercise. If it's too much, just loosen off the band and don't have it as tight. We can do different ranges of movement as well. If you're wanting to bend the knee more, make sure you flex the hips as well. So you keep the back straight and you reach your bottom back. If you try and keep your spine straight, it's just more uncomfortable actually in the knee joint, and I don't have a knee problem, but that doesn't feel nice. But if I let my hips sit back as I bend and straighten the knee, that's far more comfortable. Okay, so again, perhaps 10 to 15, 2 or 3 sets of that. All right, so step ups. I've just got a little selection of books. You can have the step as high or as shallow as you want. So thinking about my left leg, I'm going to step on to the book, make sure you feel safe, and then step back down. So simple as that to start off with. When you step up, let your weight come forward and up. So if you try and keep your weight back, you're just going to fall back, but also it's not very nice on the knee joint. So let your hips do some work as well. Think about the hips flexing and extending as well. So your ankle, knee and hip, they all move biomechanically together. Okay, so about 10 to 15 of those. I'm just going to change the angle and take the leg out to the side. So I'm going to step to the side of the book. You can take a big step out to the side if the knee finds that comfortable. I've got a table in the way, so I'm just going to limit it to this. Okay, as the knee warms up, it feels nicer the more you do. Going forward's always the most painful, pretty much always. So taking a step forward, you might want to start with a 1 or 2 less books if that's really painful. So all these exercises want to be pain-free. Okay, let the pelvis, let the chest move forward as well. We don't walk downstairs leaning backwards. 10 to 15. And then you can go from one to the other. So you can go back, side, forward, back, side, and forward. Okay, so you've got the idea there. So different height books you can work on as the days or weeks go on. Just to loosen up your knee, just draw some little circles with that knee joint. So you get a little bit of rolling action into the foot as well, so you can see me better. Need to have this sort of little rotation, so the knee doesn't just flex and extend, we do have rotation in the knee joint as well. So just by letting that knee roll in one direction, roll back in the other direction, that can feel quite nice. If you've got any points where you think, oh yeah, that's a bit sore, back off a little bit, but perhaps nudge into it, and you might find that actually eases off. If it gradually gets worse and worse and worse, obviously don't pursue that. Coming into some heel raises. Don't love a cookbook. Okay, so just the forefoot on the book. I'm just going to lift and lower my heels. So doing some heel raises is going to strengthen your calf muscles. I've got a bit of support here. Use that if needed. If you want to challenge your balance, you can always let go. So have a go at coming up into your heel raise and then slowly lower. Come up. So we're getting the eccentric lengthening control of the calves. Now your gastroc, which is this muscle here, inserts above your knee joint. So you can see at the back of the knee joint it provides support. If you're feeling strong enough, you can always do single leg work. So notice we're addressing the muscles all the way above and below the knee joint as well. Okay. 10 to 12, 10 to 15, 2 or 3 sets. Functional squatting. Up and down off a chair, toilet, your wheel bed. If your knee's very sore, pad your seat with a few roll towels or cushions. So use a table, so as you sit down, you're just touching and coming back up. When you sit to stand, you come forward and up. Okay, you don't try and stand up with your chest lifted. Your chest comes forward. It's about movement again of those hip joints, forward and up. When you come back down, you're reversing that. So you're flexing at the hips as well as the knees and reaching your bottom back. So if you've got a lift, you can do a small squat if it's painful. Again, try and keep it pain-free. And as that range gets stronger, perhaps lose holding onto the table and try and do it with holding on, without holding on. If you do need more assistance, you can sit in front of the table and use the table to help prop you up. But no, the goal is to try and do it without your hands. If you've noticed recently that you've started to use your arms to lever you off your sofas, particularly if the sofas are soft, then these are good exercises for you. Feel free to change the distance between your feet if you find it's more comfortable to have your feet wider. Perhaps even turn your feet out slightly if that works better for you. Ideally, we try and keep the feet parallel, but work with no pain, okay? Think about hands on the outsides of your knees, that can help as well. So if you can imagine there's hands on the outsides of your knees and you're pressing into those hands, pressing into those hands, pressing into those hands. You can even tie something like your belt, perhaps even your TheraBand around your thighs, and you can press out. That can sometimes give a bit of relief to the knees as well and improve your squatting. Again, 10 to 15, 2 to 3 sets. Okay, so let's just finish off with a little bit of stretching. Nice hamstring stretching. You can stand and place your foot on the chair. As we've worked quite hard, let's do a nice little lazy stretch. Just be careful that you don't overextend the back of the knee, particularly if coming into extension is painful for you. So sit up as tall as you can and lean forward. You can relax the foot down. You don't have to pull the toes up towards you if it's the hamstrings you're particularly trying to target. Having the toes pulled up towards you will include the calf and perhaps feel a bit nervy as well. So that's up to you if you want to. There's nothing wrong with that. They're just different types of stretches. Ideally, you'd hold that for a minute, perhaps even 2 minutes. And then you can come into your inner thighs. So come to the edge of the chair. Sit up tall and just walk that foot out. Foot faces forward and weight bear to the little toe edge of your foot. Sit up tall and try and get a stretch into that inner thigh. Again, holding for a good minute or two. If having the knee is uncomfortable, having the knee straight is uncomfortable, perhaps just soften the knee and just find a position of bend where actually you can manage this a little bit more comfortably. Into your hip flexors. So your hip flexors are at the front here. Hold onto the edge of the chair, tuck your hips under, and just slide your heel back till you start to feel a bit of a stretch. Try not to let your low back arch. Keep your pelvis tucked under so you're finding length through the front of your pelvis. The hip flexors there, a little bit into the quads perhaps maybe. And then to find a stretch into the quads, do one of two things. If you're flexible enough to grab hold of the back of your, the front of your ankle, then grab that foot and bring your heel towards your bottom. If the range of movement isn't there for you, then use a band. And perhaps pull that band up over your shoulder, or hold it just to the side here and bring your heel to your bottom that way. You can do this in standing. If you feel it's easier standing, that's absolutely fine too. Either way. And then last but not least, into those bottom muscles, cross your ankle over. If you can get your ankle to the outside of your thigh, just be careful with gapping of the outside of the knee joint. If that's uncomfortable, just lift and perhaps support the knee as you come forward. Sitting as tall as you can, trying to get a stretch in the buttock there. Also, if your rotation isn't great in your hip joint, that might give you knee pain. So if pressing this knee out is uncomfortable, just support the knee. And then find that glute stretch there. Okay, so hopefully those exercises will give you a bit of relief, make your leg feel a bit stronger. Ideally, probably a good 5 times a week you'd want to go through those exercises to really see a difference. If there is arthritis there that you know of, some changes in your joint, you probably need to be doing a maintenance program 3-4 times a week. So 20 minutes here and there could make a big difference to how functional and how comfortable this knee is, so give them a go. So hopefully will give you some a little bit more confidence in your leg as well, because it's important to be confident in these legs, so you don't fall and trip. Okay, enjoy them, and I hope they help.